For those of you who were with us last time, the genesis of this was to try and create a forum where leaders across London could come together to talk about key strategic issues and help us think about how we're going to provide collective leadership to that across London. At the last event, we spoke quite a lot on the what. So to remind people some of the messages that we heard at the last event, we talked about, and we just published on that day actually, the call to action for London, which set out the overall challenge for London. Some of the key headlines for that in terms of we're the region that is going to experience the most significant population change of any other part of the country, a growth of about 1 million of our population in the next 7 years. We've got the highest birth rate in the country. And unusually for us, we're seeing a change in the sense of the numbers of older people in London going to increase very significantly. So the numbers likely to increase over 65s by about 20% over the next 7 to 8 years. And all of that in the context of constrained resources. And we talked about if we continue to deliver the models of care that how we do it now, then in effect we will have around a 5 billion gap in 7 years' time across the health system versus that level of increased demand and our resources. And we then went on and talked about some of the areas that we thought that we should focus on there, and those are things that we've been talking about for a while in London. So they were issues about how do we commission better for outcomes and value, how do we get patients more engaged in their care and self-care, and how do we get the population more active in relation to their managing their own health. And certainly that's a debate has moved on in London, but it's something that we've had for a long time. A number of those issues were rehearsed in Ara's report in 2007, and no doubt he'll say a little bit about that and how the Commission will build on, but is different to that later. And I was saying to others, and some of you will have heard this before, the first report into London's health services was in 1892. And that said that our primary care wasn't very good. If we wanted to improve health inequalities, we should transform primary care, and we had too many hospitals. And we've had 10 reports since telling us the same message. So the focus of today is the how. So we want to move on to how do we do some of this stuff. And so we're going to focus on what are the different ways in which we can commission, what are the different commissioning models we can consider, and what are the things that we need to have in place that will help us make those things happen. So thoughts around payment mechanisms and other ways of things that get in the way of us actually delivering and making the change. And to give you a sense of the scale of the change, when you look at how resources are spent in London, so we get the, whatever it is, 96 billion from the mandate, money flows into London, and then it either stays with NHS England to commission services or it flows out through CCGs and for them to commission services locally. Of that funding that comes into London, 94% of it goes to hospitals and 6% of it goes to primary care. And yet all of our debate is about how do we transform the delivery models in different settings. So that would suggest that the way in which our resources are aligned to deliver that agenda require radical transformation. So that is the focus of today. And as Phil said, when we get to the end of the day, Aradarzi is going to join us and talk about the London Health Commission and where it's at in its thinking. And I think it's important that this group of leaders also engage with him in an active debate about what is it you want him to say? What are the things that are issues that if we were able to overcome them, it would make driving change so much easier in London. So those are the sorts of things that he's interested to hear. He's not got a script of things that he's made his mind up that he wants to recommend to them. And I think I've never seen such a willingness across leaders across the London system, health and care system, before, where there's a real impetus to want together to make recommendations to move London forward. So I think it's really important that we take that opportunity.